Just pardon me, let me get rid of that sound. Thank you very much. Thank you. Our technical team have helped me out with that interference that was coming through. Anyway, good morning, Africa, and good morning to colleague journalists. So welcome to our press briefing. This is the usual press briefing that we have every Thursday morning, coming from the Africa Centers for Disease Control and Prevention. So right at the outset today, let me mention that the briefing today will be 30 minutes. This then means that Dr. John will have to go through his briefing very quickly, and also that we request that you start sending in your questions, and so that we can start attending to them as quickly as possible, and also include as many as possible within the time that we have today. Anyway, it's a very good morning from the African Union headquarters right here in Addis Ababa in Ethiopia. And I will now hand over to Dr. John. But before that, let me just remind you of that WhatsApp number that you can use to send in your questions. And it is +251 945502 +251 945502 You can also, as usual, come through live or use the question and answer section. Anyway, now it's time to hand over to the Director of the Africa Centers for Disease Control and Prevention, Dr. John NKENGASONG, for his usual briefing. Dr. John, you have the floor.
Thank you, Wayne, and good morning to everyone from the Africa Centers for Disease Control and Prevention in Addis Ababa. And welcome to our weekly briefing on the situation of COVID on the continent. As of today, the 10th of June, all African member states have reported about 4.9 million cases of COVID. And this accounts for 2.9% of all the cases reported globally. The total number of deaths from all member states stands at 133,000, and this represents a case fatality ratio of 2.7%. And that ratio has been constant since we got into this second phase of the fight. The following 5 countries account for 63% of all cases reported. They include South Africa with 34%, Morocco 11%, Tunisia 7%, Ethiopia 6%, and Egypt 5%. If we look at the situation with the variants, we have, as a continent, now reported 28 countries with the Alpha B117 variant. That is the variant that was originally reported or identified in the United Kingdom. A very similar number of countries, that is 28, have reported the Beta or the B1351 variant that was originally identified in South Africa. 13 countries have now reported the Delta variant or the B1617 variant originally reported in India. So the variant situation continues to get complicated. And again, it speaks to the need to adhere to our prevention measures or public health measures as a whole, and also speaks to the need to scale up our vaccination exercise, which I will be speaking on shortly. Let's now look at 2 trends. We'll first of all look at the first week, the last week's epidemiologic trend, and then also look at the last 4 weeks. Between the period of 31st of May and 6th of June, that is last week, the continent reported 94,000 new cases. This represents a 26% increase compared to last week and this week. The following 5 countries are reporting the highest number of cases: South Africa with 33,000 cases, Tunisia 11,000, Uganda 6,900, and Egypt 6,000, and Zambia 5,200. In terms of deaths, we recorded over the last week 1,900 new deaths compared to the previous week, and that represents a 2% increase in the number of deaths. Let us now look at the last 4 weeks cumulatively. That is the period spanning between May the 10th and 6th of June. Between that period, we recorded an overall 13% average increase in new cases reported across each week. The following are regional breakdowns: 116% increase in Central Africa, 25% increase in Southern Africa, 4% increase in East Africa, 3% increase in North Africa, and 9% decrease in West Africa. The following is a breakdown of the most populous countries in Africa with respect to these changes. 33% average increase in DRC, 28% average increase in South Africa, 26% average increase in Nigeria, 22% average decrease in Ethiopia, 6% average decrease in Kenya, and 5% average decrease in Egypt. Over that same period, that is the last 4 weeks, an average of 0.4% decrease have been reported across the continent with new cases. As a continent, we've conducted about 49 million tests for COVID. And last week alone, the continent conducted 921,000 new tests. However, that represents a slight decrease of 4% compared to the previous week. The overall test positivity rate still stands at 10%. That is very high. And the test per case ratio is about 9.9. Again, that number where we are striving to reach is about 10 tests per case ratio. And let me then segue to the vaccine update in Africa. First of all, I'll start with the great news that you all heard last Tuesday when the MasterCard Foundation and Africa CDC launched a partnership called Saving Lives and Saving Livelihoods to scale up vaccine across and vaccination across the continent. That is a historic announcement. And that very specifically would do 4 things. Would support member states to acquire more vaccines and be able to immunize up to about 50 million Africans over the next, this year and next year. Support the vaccination program, that is the rolling out of vaccines in member states. Strengthen Africa CDC's own capacity to be able to deliver on its mandate. And lastly, support the vaccine manufacturing on the continent with specific focus on human capacity development. So where are we with respect to the distribution of vaccines on the continent? We've acquired 54.9 million doses of vaccines across 50 member states. And of that number, 35.9 million COVID vaccine doses have been administered. And that corresponds to 65% of total supply available in Africa. The coverage as of today stands at 0.6% that have been fully vaccinated across the continent. And this represents an increase of 17% compared to the previous week. 5 countries that have administered most vaccines include Morocco, Egypt, Nigeria, Ethiopia, and South Africa. There are a few countries that still have not yet started their vaccination program. They include Tanzania, Sahrawi Republic, Eritrea, and Burundi. As of June the 1st, Togo received about 100,000 additional doses of the Pfizer vaccine from the COVAX facility, making it the 3rd country in Africa to receive such from the COVAX facility, that is the Pfizer vaccines. Chad also started its vaccination program on the 4th of June with a priority to immunize health personnel and the elderly from the 400,000 doses of Sinopharm that they received on the 3rd. I think we must extend our congratulations to them that they received their vaccines on the 3rd and started their immunization on the 4th. That is exactly what countries should be doing. So thank you, Wen. I think I'll conclude there, and if there are further questions, we'll be happy to address them.
Indeed, thank you very much. That was Dr. John with the brief summary for today. As we said, we are with you for 30 minutes, so we'll try to run down your questions very quickly. And let me take the first one from Carlos Mureiti, and he is the East Africa correspondent for the Quartz. So he says, what are the Africa CDC's thoughts on the status of negotiations around vaccine IP waivers in light of the G7 meeting?
So, Carlos, our position, Carlos, has been clear for a while now, which is consistent with the position of the African Union. If you recall, the head of states did issue a decision of the Assembly, which is the highest organ of the African Union, supporting the need for IP waiver. So our position is fully aligned with that. I think it also will enable us to, as a continent, to advance with our regional or African vaccine manufacturing strategy.
Okay, thank you very much. We move straight on to Gabrielle Steinhauser, who is with the Wall Street Journal. So Gabrielle says, what countries are you most worried about as a third wave of infections seems to be building in many parts of Africa? Does the Delta variant appear more dangerous to Africa than other variants, given the devastating outbreak in India and the situation in the United Kingdom?
So that is a very good question. I must say at this point that 14 of our member states also are now heading towards the third wave, and aggressively so. I think that is unfortunate, but expected in a pandemic that we see these waves coming on and on until we have vaccines. I think that really highlights the need for us to roll out vaccines at speed and at scale, because that is the only way we are going to be able to win this battle against this pandemic. So we have 14 countries heading towards the second wave. I think it's the continental, if you take the aggregate data on the continent, you clearly see that the continent as a whole is moving towards the third wave. Concerning the variants, I just gave you the analysis of the variants breakdown, and you clearly see that the variant that is the variant that was identified in India, the B617 variant, is getting a hold on the continent. And as I indicated earlier, you can clearly see that just a few weeks ago, just few countries were reporting that variant, but now you have quite a good number of countries that are reporting the variant across the continent. So, but we don't yet have epidemiologic data to suggest that the variant is behind the third wave as we see across the continent. Again, 13 countries have now reported the B1617 variant, or what is now called the Delta variant. So we'll continue to analyze the situation and see if there's a correlation between the variant and the third wave.
All right, thank you very much, John. Then we go over to Peter Mwai, who is with the BBC, and he says to Dr. NKENGASONG, we have had some countries pledging donations of COVID-19 vaccines, the latest being the United States, saying that it will offer 500 million doses of the Pfizer vaccine. What is your reaction to this? And would it be enough to help African countries with their shortfalls, factoring in the storage requirements for the vaccines?
First of all, Peter, I've always stated that we should celebrate any progress and advances made during this pandemic, because we are at war, and you go to war with what you have, not what you need. And there is very much welcome news that we must recognize and celebrate. We are only beginning to learn the details. I mean, the story break last evening, and we were scrambling to understand more. And I'm sure today we will have more details, because we have now seen the press. Before I came to this briefing, I just got a press release, and we'll be analyzing that. But what we know so far is this, that of the 500 million doses, 200 million will be available this year through COVAX, and will include the 92 countries or so that are in the advanced mechanism for COVAX. And then the African Union has been explicitly mentioned in the communique, so we are very grateful for that. Will these doses contribute to the need and progress towards achieving a 60% immunization? Absolutely. It's going to be a big support for that. Shall we be able to use the vaccines on the continent? My position has always been clear. If you give me Pfizer vaccines, I will use them on the continent, because you can use them easily in major cities where you have electricity and the minus 80s or 70s deep freezers. And those deep freezers do not cost excessively, they are not excessively expensive. With $10,000 to $12,000, you can get a minus 70 or 80 degrees, and that one of them can store up to about 300,000 doses of vaccine. So I think it's a question of having the vaccines in a timely and predictable manner. That way we can plan. Planning is key in any scale-up or vast vaccination program. I was in Rwanda recently, and was absolutely amazed to see how they were set up and how they have rolled out their Pfizer vaccines. They received 102,000 doses of Pfizer vaccines, and within a few weeks, half of those was used already, and they saved the remaining 50% for the second dose immunization. So it can be done. And if it was done it's a question of organization. If it was done so quickly in Rwanda, it can be done across many African countries in major cities. We have to use a combination of vaccines to win this battle against the COVID-19. So if the Pfizer doses start coming in, our advice to member states will be to prioritize major cities. Then as other vaccines like Johnson & Johnson start arriving, because you can easily store them at an ordinary refrigerator, you can expand them to the more challenging areas or remote areas.
Thank you very much, John. You ended there with talking about Johnson & Johnson. And the next question is precisely about that. And it is coming from Sarah Jerving, who's with DEVEX. So Sarah says, when will the African Union close its order book on the J&J vaccines, and how many countries have finalized their orders so far?
So I think I don't have the details of when it will be closed. I don't want to give you misleading information, but I know that we work together as part of AVAC, and the colleagues from Afri-Exim and AMSP, that is the African Medical Supply Platform, are taking care of those technicalities, the transactions. Ours in that contribution is to determine the number of vaccines that each country will get, what type of vaccines, and so, but that is information that we'll be happy to provide you next week with the details of who has ordered, and of that 220 million doses of vaccines where they are. But overall, I can make a broad statement that the 220 million doses of vaccines are now covered, accounted for, especially given the partnership with the MasterCard Foundation, that they will naturally buy into that buy into that contract. So we'll provide you with more details next week.
Thank you. So we have a question coming from Gerald Imrai at Associated Press, and he's asking for your reaction to the announcement by US President about the 500 million vaccines. We've already gone through that, but then he also goes on to say, while it is good news, will those doses arrive on time? And is there a time frame for that?
As I said earlier, just to repeat myself, we have to celebrate. We have to celebrate those the good announcement, and again, really thank the United States government and the Biden administration for that extraordinary leadership. We don't know details of the timing. As I indicated, we are now just beginning to see more details on what that announcement entails. So clearly, a cause of celebration, and more details will unfold, and we'll share them with you with respect to timing.
Thank you. Then we go to Tamar Khan, who is with the Business Day in South Africa. And Tamar says, can you shed any light on how and why Johnson & Johnson is offering thawed coronavirus vaccines to countries like South Africa? Has it offered any thawed vaccines to other African countries? And if so, where do they come from? In other words, which countries defrosted them, and why don't they want them anymore? And lastly, what is the Africa CDC's view on this? Do you have any concerns about it?
Not about thawed vaccines?
Yes, so she's saying that some of the vaccines have defrosted and they've thawed, and these are vaccines from Johnson & Johnson. So she wants to know if this has happened to other countries, because she states here that those vaccines have been offered to countries like South Africa.
So just to be very clear, I don't have any information on that story. And Johnson & Johnson, to the best of my knowledge, is only used in South Africa. I think we have not yet seen any shipments of Johnson & Johnson to any country in Africa. The first shipments of Johnson & Johnson, as we have indicated on this platform, will start going out in August. That will be the first set of deliveries that will be leaving the factory in South Africa to member states. So I don't have any information on that story.
Okay, I think that we have come to the point where we need to just visit one of our WhatsApp groups. If you can give me a minute to find that question, and it is coming from Della Russell. Della is with the Daily Graphic in Ghana. So let me just look for that question. Yes, I found it. And so Della says there is an ongoing controversy in Ghana presently over the procurement of Sputnik 5 vaccines through middlemen at costs ranging from $19 to $26 per dose, instead of the $10 a dose that is the stipulated price. What will be the Africa CDC's advice to member state governments who are also procuring separately from the coordinated continental purchase being led by the Africa CDC and its partners, particularly as regards to price and negotiations, as well as direct access to manufacturers?
So that is a very good question. And let me start off by saying that I don't have any information or detailed information on what the situation in Ghana is. But I can tell you that when we discussed with the Sputnik folks, their pricing was, that they quoted was $9.5 per dose, so that the 2 doses will be around approximately $20. That is the price quotation that they gave us. Now, what happens when a country deals directly with a manufacturer is really out of our hands. And I think unfortunately, I would not be able to comment on what the transaction at a country level is.
Okay, so let us take our last question, and it's coming from Janice Q. Janice doesn't write her news organization, but she says, could Africa CDC comment on the total dollar figure that it is targeting from funding arrangements, such as the one with MasterCard Foundation? And she has just sent in a message to say that she's with Bloomberg.
So when we started our analysis, and in leading up to the development of the continental strategy for COVID vaccine access on the continent, we are very clear that based on our analysis, we will need up to about $10 billion for the continent to be able to immunize itself and get up to at least 60% of the population immunized. So that was the projection at that time last year. So we continue to believe that there will be need to get resources for vaccination, which is the actual act of rolling out the vaccines, in addition to the money that is required for acquiring the vaccines as a collective. So that is the overall ballpark that we had estimated and projected at that time.
Thank you very much, John. I think now it's time for you to sum up by just giving us the main highlight points that you want people to take away from today.
No, thank you, Wayne. The continent is going through a third wave, no doubt about that. And we know that on the 8th of May, we convened an emergency meeting of the ministers of health and agreed on adapted strategy in anticipation of that. Anyway, because we knew that we were going to definitely have a third wave because that is the nature of pandemics. And there are three things that we continue to highlight. One is that we must enhance our prevention efforts. And that will include two things, that the public health measures must be maintained, including masking, social distancing, avoiding crowded space, because when we crowd come together, you offer the virus a chance to spread. I think that is just very important. And masks worked, we know that. And masks for now are our best vaccines for the continent. We're waiting for large-scale vaccinations to happen maybe later towards the end of the year. Then we also talked about in order to tackle this third wave, we must have enhanced monitoring, which means surveillance. We must use the rapid antigen tests that we have to improve and strengthen our surveillance system. That way we pick up the hotspots before they become problematic, for the hotspots for emergence of this virus before they become problematic. We also talked about the need to have enhanced monitoring of the variants. We now know that the variants are extremely impactful to our program. They create, in some scenarios, less efficacy for the vaccines or effectiveness for the vaccines. And secondly, transmission can actually be enhanced by up to 40% in with some of the variants. And lastly, that all countries, as we move towards the third wave, must arm themselves with treatment facilities that include availability of oxygen and other treatment-related commodities. I think that is the key message for this week, is moving towards the third wave will require that we do the things that we have been doing even more, because we are not helpless. We have some tools in our hands, and the ability is to work with the community to make sure that these tools are properly implemented.
Thank you very much. That was Dr. John NKENGASONG, the director of the Africa CDC, and bringing this press conference to a close. Let me thank you very much, colleagues, for cooperating with us. We had a very short period of only 30 minutes for today's press briefing, and you did comply by just asking your one question and also being very precise in the manner that you put the questions that allowed us to come out in the 30 minutes that we had. But for next week, we will be back to our usual 1 hour, and that will be at 12 noon East African time. So please join us again next week as we continue to share information on the COVID-19 pandemic, as well as the interventions that are being done at continental level. So thank you very much. Thank you, Dr. John, and thank you to everyone in the studio. This is a promise. We can extend it next week. All right, that's good. So next week we'll have slightly more than an hour. Thank you very much, colleagues, and bye-bye.
Thank you.